Well, Jessica, I've got your pregnancy test result. I think it's going to be good. The test was negative, which tells us you're not pregnant. And we'll figure out why you're a little late, but most probably it's not anything to worry about.
Oh, good.
Good. Tell me, a lot of relief? What's going on for you?
Yeah, very relieved. Yeah.
Good. So, we take 5 or 10 more minutes, just have me ask a little about where we go from here.
Okay.
Do you have 10 more minutes?
Yeah.
I'm seeing your relief, Jessica, and yet when I was doing the intake, you said not currently on a method of contraception.
Mm-hmm.
And so I just want to kind of understand how we help you moving forward. Usually when someone is pretty sure they don't want a baby, a method of contraception is in the discussion. What have you thought about in terms of contraceptive methods?
I've never used one before, but I am open to it. I definitely know I don't want to be pregnant right now.
Well, help me figure out what I can do, Jessica. I'm going to ask you a couple questions using the scale that helps me figure out the best way to help you. Just, if you would, on a scale of 1 to 10, how important would you say not getting pregnant is? 10, it's a big deal. 5, it's sort of important. 1, it's not that important. How important is avoiding a pregnancy right now?
8 or 9.
8 or 9, okay. So it's a pretty important problem. Why an 8 or 9, say, and not a 7? What's important to you about not getting pregnant?
I already have a couple of children, and now's not a good time for more. I just, it's a lot to handle right now.
Okay.
So.
How old are your children?
I have a 3-year-old and a 5-year-old.
Okay, so, yeah. So 2 kids under 5, 2 kids not in school yet at home, and adding another one would be?
A lot.
A lot, okay. So now's not the right time. Second question I wanted to ask, how confident are you that you could be a user of contraception? 10, if I make my mind up, I'm confident. 5, I'm pretty confident. 1, I'm not very confident. What's a number that would describe where you're at today?
I think I could, but I'm concerned because I don't know if my boyfriend wants me to.
Okay. So a number would be 5 or 6?
Yeah, 5.
5, okay. And it sounds like how I could help you is maybe help you become a 6 or 7. What could I do that might help you be a little more confident? What we talk about? Your boyfriend's name is?
Chris.
Okay. One option we have, Jessica, is to have a session with him and bring him in and talk about methods. Is that something that would be helpful?
I don't know how I feel about that because I think he does want kids and doesn't want me to be on birth control. And I'm just concerned that would cause some disagreement.
And what happens when there's disagreement for the 2 of you?
We just fight. And
are you happy with Chris as a relationship?
Oh yeah, he's wonderful. He's a good father to my children, and he's a good provider, and yeah, it's good. I just don't like it when we argue.
Okay. And so this is one point of contention that you stay away from. Okay. Well, we are in the business of family planning. We've got very effective methods of avoiding a pregnancy. You said you've never used a method. Have you had girlfriends or sisters or people you know who've used birth control? Are there what have your girlfriends said is a good method, or what have you heard about good methods?
Well, I know a lot of people who are on the pill,
Right.
And who do the shots.
Good. Good.
Those are really the ones probably that I've
Good.
heard the most
No,
about.
you've done some good thinking. Those are both really effective methods. We've got a kind of ethical decision. Jessica, you would be more willing if we could come up with a method that Chris didn't have to know about. Am I hearing you right?
Yeah,
Okay.
I think that would be.
Okay. We have women often for whom this decision is not an easy one, but who decide based on where they're at that the right decision is to proceed with the method even without their partner's knowledge. And, I'm happy to help you. It sounds like methods that don't require his consent, so condoms are out of the mix.
Mm-hmm.
Pills would be around the house, or he might see them in your purse.
Mm-hmm.
The shot is something he'd never know about. It's called Depo-Provera.
Mm-hmm.
We'd give you that injection every 3 months. Come back every 3 months. Shot. Visit would take half an hour or so, 40 minutes, depending on the wait time. Minimal side effects. We've got another one that's a great option. Not invisible. There's a matchstick. Think about what a match, small match, that's inserted under your skin here. So there'd be a little bump under your skin. He'd have to know exactly where he was aiming. That gets you 2 years of 3 years, 3 years of really effective protection. The only other one that I'm thinking about, he'd see a patch, he'd have to see a female condom. The only other one, there is a ring that's treated with hormones. Have you heard of the ring?
Oh, yes. I've
Okay,
heard
so
of
it's inserted.
Mm-hmm.
You'd insert that. The only thing is, he'd feel it during sex, so we need you to take that out before sex to a clean place, or he potentially could feel that during intercourse. So probably in terms of your goal, Nexplanon, the shot, or the ring, as long as you could remove it. Of those, is one sounding like the better match for you?
Maybe the shot. Are they all similarly effective?
Absolutely.
Okay.
They're all in the more than 99% effective. The great thing about all three of those methods, certainly the first two, the Nexplanon and the shot, you don't have to remember to do anything. It just happens. As long as, with the shot, as long as you get here every 3 months. So efficacy is between 99 and 100%. So most methods don't offer 100%, but I've been in family planning 15 years. I've never had anybody who showed up for their appointments every 3 months. I've never had anybody get pregnant on Depo. It's a really effective method.
Mm-hmm. That sounds like it may be.
Okay. Nobody knows
choice.
about it. You get yourself here on your own every 3 months. Okay.
Okay.
It's up to you, Jessica. We have a couple options. I actually have some ready now. I mean, I do it every day. It's something we could go ahead and do now and do a follow-up in 3 months. You have the option to think about it, and I'm free later this week, first of next week. I've got a lot of availability next week. We could schedule a time, have you come back. What's the best choice for you?
Maybe next week, just so that I can think about it a little more.
Okay, that's fine. Again, I know it's not an easy decision, the decision to do this. What I heard you saying is, now's not the right time. Couple kids. When I saw your relief, Jessica, what I said is, I can help you feel that relief all the time. With this shot, you won't ever have to go through this, I wonder, again. And if you decide it's right for you, I'm happy to help you do that.
Okay.
Why don't we get our calendars? You got your phone there. Why don't we both look at next week, maybe set something up? You could go online and do some research. Like I said, I'll write the name down. It's Depo-Provera. Probably if you just do the Depo shot, it'll come up. A lot of research online. We can talk. You can think about the pros and cons, and we'll come back, think of Tuesday or Wednesday next week.
Okay.
Is one better for you than the other two?
let's do Wednesday.
Great. Let's get it on the book.
Okay.
Great.
Thank you.
Thank you.